Namaste. Thank you for joining us on SLG Hello Doctor, your fortnightly virtual digest of health information. An estimated 32% of all deaths occurring annually worldwide can be attributed to cardiovascular diseases, or to put it in simple terms, a group of disorders related to the heart and blood vessels. Today, we will understand from Dr. Hariram, consultant cardiologist at SLG Hospitals, Hyderabad, the causes, symptoms, prevention and treatment of coronary artery disease. Dr. Hariram, welcome to SLG Hello Doctor. We are so glad to have you here with us today.
I am also very glad to be a part of this SLG Hello Doctor program. So, shall we proceed, ma'am?
Yes, absolutely.
Yeah,
Let's start the conversation.
Right.
So, doctor, first of all, what is coronary artery disease?
I'll just show you. This is basically the small prototype of the heart that we have. So basically, for the heart to function, the muscles, this is the muscle. The muscles to function, it requires blood supply. And there are 3 blood vessels supplying the heart muscle. And whenever there is any blockage due to any reason in the blood vessel supplying the coronary arteries, then we get what is called as a coronary artery disease. So I'll just tell you what is the progression, what happens. So if you can see, this is the normal, this is a cross section, we have cut the blood vessel of the heart. So this is the normal blood vessel. Usually as the age progresses, because of the food that we eat, the genetic factors, environmental factors, small particles of bad cholesterol starts getting deposited. So this is one way of progression of the heart disease. So as you can see, studies have found out that even by the age of 20 years, we can see small streaks of fats getting deposited in the blood vessel. So as age progresses and we don't have any control over our diet or exercise or the body weight, so gradually the cholesterol gets deposited, and then it reaches a stage where it totally blocks the blood vessel of the heart, and then we may get various types of presentations of the heart disease. So this is one way of presentation of the heart disease, a gradual deposition of the cholesterol and other substances in the blood vessels, and then leading to a blockage. But sometimes in young patients, you must have noticed or you must have seen that some 20 or 25-year-old adult, 25-year-old young people suddenly getting heart attack and dying. So the presentation is different in those people. Basically, the blood vessel lining split at a particular point because of various reasons. There is no deposition of the cholesterol, may or may not be there, but the mechanism is different in that the blood vessel splits and then exposes the underlying substances, and on that the clot forms, and then totally the clot blocks the blood vessel, and the person gets a heart attack. So the difference is that in young people, usually the blood vessels are almost normal, and because of various reasons which I will be telling, especially smoking, the lining of the wall becomes fragile and it splits and exposes the underlying substances over which a clot forms. But in older patients, cholesterol gradually gets deposited, and as the deposits increase, the blood flow gets obstructed and they get all these symptoms. The blockage basically of the blood vessel supplying the heart is called as coronary artery disease. And different presentations are there. So what is called as a chronic stable angina, this is the most commonest presentation that we see in elderly people. So they say that we were previously walking around 5 to 10 kilometers per day. Now on walking around 3 to 4 kilometers, I am getting chest pain or breathlessness and I have to sit. So this goes on for some time, 3 or 4 months or 5 months, and gradually the distance gets reduced and patients start complaining of pain even after walking 100 meters. So this is the sort of presentation most commonly we see. The second type of presentation is suddenly patient gets chest pain at rest. He is not doing anything and suddenly gets chest pain at rest, and this is called as an acute coronary syndrome. And this also we can divide it into 3 different presentations. One is a major heart attack, that usually we say patient had a heart attack, severe heart attack. So in those conditions, the blood vessel gets blocked 100%. There is no blood flow and muscle gets damaged. This is acute ST elevation MI, what is called as ECG showing major changes. The second type of presentation is non-ST elevation MI, where the ECG may or may not show much changes, and blood vessel is usually blocked more than 95%, 99%, but some trickle of blood flow is still there, because of which major heart attack is not there. But blood tests usually show that there is some damage. It's some tests called as troponins, they are positive. In third presentation is called as unstable angina. where the blood vessel is blocked to around 90% and patient gets chest pain. ECG may or may not show any changes, and even blood tests may or may not show any changes. So these are the different presentations how a person may get heart problems.
So doctor, what are the risk factors associated with CAD?
We can divide these risk factors according to modifiable risk factors and non-modifiable risk factors. Basically, what is a risk factor? A risk factor is something which is, if present in a particular person, that particular person is more prone to get a heart disease. So what are these risk factors? Most common risk factors that we usually see and listen day-to-day activities is high blood pressure. So anybody who has high blood pressure is more prone to get heart disease. And second is diabetes, especially uncontrolled diabetes, people who are dependent on insulin. And third is high cholesterol levels, especially the bad cholesterol, LDL cholesterol. So these three are very important risk factors. And fourth is age. As the age increases, definitely the risk for developing coronary artery disease also increases. Males are usually more prone for development of coronary artery disease till certain age. After around 60-65 years, it becomes almost equal in both males and females. And most important risk factor, especially in young people, is smoking. Most of the times we see young people 25 to 30 years, they don't have any other risk factors, but smoking is the most important thing. So these are some of the important risk factors. Some of them can be modified, like smoking, definitely we can stop and it can be modified. High blood pressure can be controlled, diabetes can be controlled, cholesterols can be controlled. But there are some risk factors which we cannot control, like genetic risk factors, family history. Suppose if somebody in the family has a heart disease at a very early age, say males less than 55 or 60 and females less than 60, then the other members in the family are more prone to get heart disease and they should be evaluated thoroughly.
Doctor, having understood that, I think it's important for us to know how to identify the early symptoms of CAD. So can you talk about that, please?
So this is one of the very important thing that people should know, like what are the symptoms of coronary artery disease. So the typical symptoms of chest pain, somebody clutching the chest like this, is usually present in only around 10 to 15% of the patients. So if somebody has any other symptom, they ignore it and then land up in late stages. So any chest pain right from the jaw to the umbilicus can be a symptom of coronary heart disease. Like somebody is having a pain in the left arm, somebody having a pain in the right arm, and somebody has pain in the abdomen, somebody has pain in the jaw. These all pains can be because of coronary artery disease. So just don't ignore these symptoms, especially if this pain is increasing on doing any activity. Suppose if you are walking and you get chest pain, or you get a throat pain, or you get pain in the arm, you get pain in the abdomen, don't ignore this. So apart from this chest pain, if there is associated sweating, also you should think more in favor of heart disease. Other important symptoms may be like breathlessness. So somebody has breathlessness on walking, and then when he rests, the breathlessness disappears. Also, this is one of the important symptoms. And third is palpitations. That is any fast beating of the heart. Suddenly it comes and then it goes off suddenly. Also, you should keep in mind that this can also be because of some heart disease. And anybody suddenly falling down, losing consciousness also can be because of heart disease. These are the usual important symptoms, but many of times there may not be any symptoms. That also you should keep in mind.
Doctor, amongst all the other symptoms, you also mentioned about throat ache and pain in the jaw. Now, normally none of us would associate it, either of these with heart disease. So when does one start to really think in terms of meeting a cardiologist? Will the general physician tell us? How does it happen?
Now, anybody having a jaw pain which comes on walking, especially the elderly, so choking sensation or jaw pain, this is very typical of a heart disease. Normal pains, throat pains which do not come on walking may not be associated with heart disease, but typically anybody having a choking sensation or a jaw pain which is coming on activity, which is coming on exertion, doing any activity, this is a very important symptom that should not be ignored, and you should always see a cardiologist.
Doctor, that's something really very unique that we learned today. And to associate it with walking or any activity, I think one should be really alert to all of that. Are there any specific tests to detect CAD?
Yeah. Basically, these tests are very important things for us to diagnose a coronary artery disease. It depends on the type of presentation. somebody has chest pain on walking and comes for a routine evaluation, we do three important tests. One is the ECG. ECG gives us electrical disturbances in the heart. This may show changes only when there is a major heart attack. This may not show changes when the disease is not reaching that critical stage. So many people say, sir, ECG, is it not enough? Can you just diagnose on ECG? My ECG is fine. I think I don't have any heart disease. This chest pain may not be because of heart disease. No, ECG only gives us positive changes only when the disease is extreme or very severe. And second thing is 2D echocardiogram, which gives us what is the pumping of the heart, all the segments of the heart are moving equally or not, and whether the valves are opening, closing normally, whether there is any leakage, valve is not opening or valve is not closing, what is inside of the heart, outside there is any fluid is there or not. So most important, we get what is the function of the heart. So, and the third important thing, and even this 2D echocardiogram may not show changes until and unless the disease is quite extreme. Even with a 99% of the block, we may not have any ECG changes or when 2D echo changes. Once 2D echo changes appear, it means that the damage has already started. So again, this question people ask that, sir, ECG, 2D echo are normal, why we should go for further evaluation? Because even a significant blockage may not show up in ECG and 2D echo. That is why we always advise a stress test, either a treadmill test or some other nuclear medicine stress test or some test. A stress test is very important in order to bring about these 90%, 95% blocks which have not shown up in ECG and 2D echo. So in a treadmill test or any type of stress test, what we do is we stress the heart. Normally the heart is beating at 70 to 80 beats per minute, and even a 90% blood blockage, the small amount of blood flow may be adequate for functioning of the heart during that 70 to 80 beats per minute stage. So once we give stress, suppose we make you walk on the treadmill, the heartbeat increases to 150 or 160 beats per minute. So heart is doing double the work. And if the blood supply is not adequate, then the changes may appear in the ECG or typical symptoms may develop during the treadmill test. So depending on these ECG changes, we diagnose that the possibility of heart disease is there and you should go for further evaluation. So let us say somebody has a ECG changes or 2D echo changes or treadmill changes. Then in order to confirm that there is blockages, we usually go for what is called as a coronary angiogram, where we put a small tube inside the blood vessels and reach the heart and inject a dye and see in the X-ray what is the amount of blockage and how many vessels are blocked and any other complications are there. For somebody who is not very keen to undergo coronary angiogram but has changes, there is also another investigation called a CT angiogram, where with the CT scan itself we can diagnose. It is a lesser invasive procedure and it will also give us almost equivalent information as the normal invasive angiogram.
That was quite a bit of information that you shared with us, doctors. Can you now elaborate on the treatment options available for patients of coronary artery disease?
The treatment also depends on what is the type of blockage and how many number of blood vessels are involved. So broadly we have three treatment options. One is a medical treatment. Second is a treatment by percutaneous intervention, where we put a tube and then do interventions by putting stents. And the third is a surgical treatment. Anybody who has a coronary artery disease, any blockage is there, medical treatment is very important in addition to either stents or surgery. Whether a person goes for stent or surgery usually depends upon the extent of the blockage, number of blood vessels involved, whether it is feasible for putting the stents or not, and most important is the patient choice. So, but most important is medication, and in addition to medication, depending upon the type of anatomy of the blockage, number of blood vessels involved, we either go for a stent placement or we go for a bypass surgery. So in a stent placement, we basically put a stent at the position at the blockage site. In bypass surgery, I'll just show you. So in a stent, this is the blood vessel. We put a stent here by passing a tube through the heart. In a bypass surgery, if the blockage is here, we usually take a vein graft from the leg or from the arm itself and then connect it beyond the blockage from the main blood vessel, the aorta. Okay, and in from the hand, it is called as the internal mammary artery. We divert it and then attach to the blood vessel beyond the blockage. So this is basically we are bypassing the blockage and then providing an alternative supply from a different position. So even if the blockage progresses, we have an alternative route which supplies the blood.
It's break time on SLG Hello Doctor.
ప్రపంచ స్థాయి మల్టీ సూపర్ స్పెషాలిటీ హాస్పిటల్ SLG హాస్పిటల్స్
4 ఎకరాల సువిశాల ప్రాంగణంలో 999 బెడ్ల సౌకర్యంతో గ్లోబల్ JCI అండ్ NABH ప్రమాణాలతో అనుభవజ్ఞులైన వైద్య నిపుణులతో అత్యంత క్లిష్టమైన గుండె సమస్యలకు శస్త్రచికిత్సలు చేయబడును.
మెదడు మరియు నరాల సంబంధిత సమస్యలకు మొట్టమొదటిగా న్యూరో నావిగేషన్ టెక్నాలజీతో చికిత్స.
క్యాన్సర్ చికిత్స కోసం లీనాక్ వంటి అత్యాధునిక వైద్య పరికరాలతో చికిత్స.
కీళ్ల నొప్పులు, ఎముకలకు సంబంధించిన సమస్యలకు మరియు జీర్ణకోశ సంబంధిత వ్యాధులకు మెరుగైన వైద్యం అందించబడును.
20 అత్యాధునిక ఆపరేషన్ థియేటర్లు, 200 ICU బెడ్స్, అత్యాధునిక డయాలసిస్ సదుపాయం కలదు.
24 గంటలు ఎమర్జెన్సీ, డయాగ్నోస్టిక్, ఫార్మసీ సేవలు.
3 టెస్ట్ల MRI, CT స్కాన్ వంటి అత్యాధునిక వైద్య పరికరాలతో మరింత మెరుగైన సంరక్షణకు మీ ఎంపిక SLG హాస్పిటల్స్, నిజాంపేట్ రోడ్, బాచుపల్లి, హైదరాబాద్.
సెల్ నంబర్స్ 9133395500.
ఫోన్ నంబర్స్ 914023785678 మరియు 48525678.
టోల్ ఫ్రీ నంబర్ 1800599220.
ఎమర్జెన్సీ 7799235678.
ఆంధ్ర ఆరోగ్యశ్రీ సదుపాయం కూడా కలదు.
Welcome back to SLG Hello Doctor. We are in conversation with Dr. V. Hariram, Consultant Cardiologist at SLG Hospitals, Hyderabad, and we are talking about coronary artery disease. Doctor, obviously lifestyle habits play a major role in preventing or managing coronary artery disease. So can you give us some advice about what type of lifestyle habits we should adopt and we should let go?
This is a very important part of the treatment in coronary artery disease, and the useful thing is that it is very cheap. So you don't need to pay anything for your lifestyle modifications. So the most important thing is exercise, and so what we advise for anybody is this is not only for some people who have already established heart disease. This is also for anybody who think of preventing heart disease in future. So the most important thing is exercise. In exercise, what we mean to say is that walking or anything more than that, but a minimum walking for around 30 minutes at least 5 days of a week. Anything more than that is depending upon the patient's or person's comfort levels. If somebody has any difficulty at any stage, I think they should stop and then gradually improve or increase the exercise capacity. Another important thing that many people have doubts about is diet. What type of food they have to eat, and whether what type of oil they should eat, and whether some particular foods are there which can prevent heart disease and other things. So first we will come one by one. First, what is type of oil? There are particular diets like the Mediterranean diet where they prescribe olive oil for use, but in our Indian setup I think using olive oil may be a bit difficult. It can be used as a dressing for salads, but for deep cooking I think we have to use our regular oils. So what we say is that any oil which stays liquid at cool temperature, like suppose we have a coconut oil which becomes solid in winter, it is a saturated oil, fully saturated oil. Oils like that, like another example is vanaspati, ghee and palm oil. All these oils are not to be consumed in excess, or better to be avoided. Especially coconut oil, which has very people using in Kerala, they have a very high incidence of coronary artery disease, basically because of this fully saturated oil. Any oil which becomes solid at a bit of lower temperatures, usually it is better to avoid. Any other oil which stays liquid, like groundnut oil, sunflower oil, safflower oil, rice bran oil, those oils can be taken, but any oil should be in limited quantity. And these oils, whether you want to mix it or use it, or you want to alternate it, say 3 months you use groundnut oil, 3 months you can use sunflower oil, 3 months you can use another oil, or you have now combination of oils also available. So these things are allowed in reasonable quantity. There is nothing like a good oil. Other important things are any specific thing which is there to prevent, like eating garlic. So a large number of studies have been done where they have shown that it may or may not be of much use, but You can always use it because it has not many side effects. Another is this flax seeds. Flax seeds also supposed to be useful in reducing the certain types of bad cholesterol. So you can use it as a powdered form, or you can use it, even capsules are also available. They have basically good fatty acids which are responsible for decreasing the bad cholesterol.
Doctor, let's say I have a family history or I'm genetically prone to getting coronary artery diseases. In that case, what lifestyle habits should I adopt right from the beginning?
So if somebody has a strong family history of heart disease, somebody say around 30 years of age, 40 years of age, somebody's brother had a heart attack or father had a heart attack. So these people should be more careful. First of all, they should get evaluated for their basic workup, like whether they have any blood sugar or blood pressure or lipids, what is their cholesterol levels, and if at all any abnormality is found in these, like blood pressure should be controlled properly. If they have diabetes, sugar should be controlled properly. If the cholesterol levels are high, they should be controlled adequately with proper medications. And another important thing is frequent evaluation, because many of those relatives may not have any symptoms and they may have had a sudden event. So it is very important for a frequent evaluation. Basically the important investigations that I have mentioned previously, like ECG, 2D echo or a treadmill test, these should be done at more frequent intervals, especially in those people who have a higher risk. And lifestyle modification should be started at an early age. No smoking, very important. A good exercise routine should be developed. It's not like you do exercise on one day and then stop for 1 week. That is not going to help. And at least for 30 minutes, at least 5 of 7 days. And avoid junk foods, especially the young people who have a strong family history. These burgers and pizzas, high cheese based foods, so these all should be avoided. Alcohol also, if possible, better should be avoided. And because it has been shown that though there are few studies that it may help, but it is very difficult to control once you get used to it. So it is better not start it at all, and if at all somebody is taking, limit it to a very minimal level. So these are the important things that somebody should take if they have a strong family history of a heart disease.
Highly obliged, Dr. Hariram, for explaining so much in detail about coronary heart disease and how to deal with it. And thank you so much for being here with us on SLG Hello Doctor.
Thank you very much.
We'll see you back here in 2 weeks from now. Until then, be aware, be safe, but enjoy responsibly. Viewers, don't forget to hit the bell icon to keep yourself updated on all that's happening at SLG Hello Doctor.